Hello, everybody. This is Professor Zaire Shamika. I am going to give you an online learning course on the musculoskeletal issues that we should be covering this week during the break. This way, when you get back to class, you'll be able to take your exam by hearing what I had to talk about and also by reviewing the PowerPoints. There will be videos in the PowerPoints that I'm going to skip over. You'll be able to watch those videos, and I recommend you take notes on those videos because they will be a part of the exam. So we'll do the 15 minutes on each topic. I'll time them, cut them, so that you can break, go eat, go to the bathroom, whatever you want to do this week, watch a little bit of football, but have a great time. So let's start out with the diagnostic studies. We're going to be talking about x-rays, CT scans, MRIs, bone scans, arthroscopy, and arthrocentesis, along with EMGs. Always, before you send your patient down for any of these diagnostic tests, you want to always identify and verify that it is the correct patient. They have their allergy bands on. For a lot of these tests, you're going to be keeping them NPO. You want to make sure that you do the appropriate screening, and we'll talk about that with the MRI in a little bit. The length of the test, the patients will ask you about that. They may ask you about positioning. Are they going to be on their side, their back? These are the things that you must always, always, always let your patient know about. X-rays are used for diagnosis and purposes to determine what the density of the bone is. There are various views. You can get a 3D, a 2D, various views of X-rays. You always want to verify before an X-ray of any sort or any procedure that the patient is not pregnant. You want to avoid exposure to X-rays of the patient and yourself by using shields. A lot of you are young enough to still have children. You always want to verify that you're not pregnant as well. So it's very important to do so. Here I give you just a picture. It is July 1st. I can tell you all residents love, love, love to show nurses things. So if you have the opportunity to have someone explain what you're looking at on the X-ray, take the time and get that knowledge, because it will help you in the long run to know what exactly you're looking at, especially when you're an orthopedic nurse. A CT scan or a computed, I want to say it appropriately for you so you get it right, but the CT scan is an X-ray beam in conjunction with the computer as well. It is a computerized tomography scan that combines a series of X-ray images that are taken from different angles and uses the computer processing to create a cross-sectional image. Basically, they're like slices of picture of the bone, the blood vessels, and soft tissues inside your body. The CT scan images provide a more detailed information than just a plain X-ray does. And also, they're very similar to MRIs, but they provide a much different view of the body than an X-ray does. Here I give you a picture of an MRI. They can be open or closed. You will see that some of your patients that are going for the MRI will have to be pre-medicated. Often, well, always, you're going to have to fill out a form that finds out if your patient is claustrophobic. Do they have any shrapnel or metal in them? They will ask, have they ever worked in a place that has metal, an aluminum factory, U.S. Steel, various things. They look at their eye, do a screening to see if metal could possibly be in their eyes. If they have a pacemaker, you want to ask about that as well, because nowadays there are pacemakers that they will allow to go through an MRI, but typically the older pacemakers have metal parts, so you want to screen your patient thoroughly. The MRI and the CT are very similar, as I said, but the MRI uses radio waves and magnetic fields. MRI does not use X-rays. It is a very powerful magnet. You have to screen your patient because of that magnet. Over the last 30 years or so, thousands of pregnant women have had MRIs, and no one has found any harm to the baby. But what you have to think about with the pregnancy is the MRI, if it requires contrast materials. One of them that we gave at the hospital is called gadolinium, and they'll inject that into the veins in the arms. And those type of contrasts, they don't usually use that with pregnant. They will not use it with a pregnant woman. You're going to have OB and pediatrics in a rotation coming up in the summer. They'll go more deeper into that. You'll have Dr. Gamong. She'll go deeper into that with you. A DEXA scan. This is something that bone density scan is something that you should probably read about a little more. It's also known as a dual energy X-ray scan. It uses a small dose of ionizing radiation to produce pictures of the inside of the body. Usually they're looking at the lower spine with a DEXA scan and the hips. And we'll talk about the scan a little more when we talk about hip fractures and dislocation. It's commonly used to diagnose osteoporosis and to assess an individual's risk for developing fractures. It requires very little preparation. You always ask if the patient is pregnant, and have the patient let the technician know that, because recently they have been doing some barium exams where you get that injection of contrast. A bone scan. With a bone scan, as I said, it involves an injection of that radioisotope, and what you want to do with your patients who have the bone scans is explain that the radioisotope is given about 2 hours before the procedure. You want to ensure that these patients that are going for a bone scan, ensure that their bladder has been emptied, and inform the patient that the procedure requires about 1 hour, and the patient will be in a supine position, and that no pain or harm will result from those isotopes. However, what you want to do, and remember, when your patient returns from a bone scan or any procedure where they get any type of an injection of contrast or radioisotope, you want to ensure that they get fluids after the scan. So if they come back up and they're on IV fluids, they should be on maybe a normal saline of such. If they're going home after a bone scan of some sort, then they should increase their fluid intake. You need to flush the system post-exam. Arthroscopy. Arthroscopy is a endoscopic examination of the joints. It is invasive. It is a procedure that is used to diagnose and treat joint problems. Here they insert a narrow tube attached to a fiber camera through a small incision, and the incision is about the size of a buttonhole. But they view inside your joint through, and they have this video monitor up that they look through. And it allows that surgeon to see inside the joint without making that large, big incision. They can do some repairs during that time as well. with this pencil thin surgical instrument. And I do have a video on here for you to watch. You can do that on your own. The video will show shoulder arthroscopy, but as you can see in this picture I'm giving you on the screen, this is knee arthroscopy. You should review this video. It has a lot of information in there that you may see again. So review the video and watch that video. I'm going to skip by that video. You can do that on your own. We're going to talk about arthrocentesis. This is an incision or puncture of the joint capsule. It is an invasive procedure. They will give your patient a local anesthesia, and it is an aseptic technique. When they do arthrocentesis, they usually aspirate some synovial fluid that's inserted in the joint cavity, and they take that fluid, put it in a test tube, send it down to the lab to have it, the specimen, the pathology of the specimen done. Now, normally it is clear and colorless, but it would be most concerning, you feel me, most concerning, if the patient who you have coming in for arthrocentesis returns back with this knee pain. Say, you know, the puncture was done in the knee, in the joint cavity, and the drainage that comes out from the arthrocentesis now that's being done is a purulent fluid. That is very concerning. So you always ask the patient when they come back and say they've had some pain about the drainage or purulent fluid that may occur after the arthrocentesis or during the procedure. If they suck back that synovial fluid and it's purulent, when they send it to the lab, that would be most concerning. That occurs usually about 7 days post after the arthroscopic procedure. If they're complaining of pain, it's usually in about 7 days or so. I'm going to stop this right here, and then we're going to go into the next section.